All right, y'all. Welcome, welcome, welcome. My name is Dr. Samaria M. Colbert. I'm the founder of Kingdom Creative Counseling. We are a licensed private practice for counseling practice. I'm a published author, and I help people to get free spiritually, emotionally, and mentally free through Jesus Christ. Let's get it going. I'm excited. Hopefully you guys are excited. Well, first off, shout out to everyone who watched our live on last week with Minister Tanika Goody. Excuse me, I pronounced her last name wrong. We did a great job. I had such a wonderful time speaking with her, and we are going to do it again. We already planned another session, so that's pretty cool. And it is available on both my and her YouTube channel. We talk about toxic love, and it was really, really good. We were just vibing off of each other. But today we're going to talk about therapy. Therapy, for those who don't know. Well, you know, but let me introduce myself. Give me my moment, okay? I am a licensed therapist. I had been in the mental health field for a little over 15 years. Now, it just feels weird to say that because it doesn't feel like it's been that long, but it really has. I didn't always do therapy because for those who don't know, you can do different things within the field of counseling or mental health. I've worked in group homes, particularly when I was going through graduate school, worked in group homes a lot for the mentally ill. I worked inpatient hospitals, long-term inpatient hospitals. I used to work at Dorothea Dix Hospital. That has closed years ago, but I was there. I was one of the social workers there. Worked inpatient in another hospital there. I've done outpatient clinics, worked crisis. And I always had a heart to counsel folks. And I knew that I would eventually start my own private practice. And that's what I've done a few years ago. And again, the name of my practice is Kingdom Creative Counseling. And what we do is I am licensed, we do accept insurance, but I also integrate a person's faith practices, and understand that Jesus is ultimately the wonderful counselor. The Holy Spirit is ultimately the one who leads us. However, it is in line with the American Psychological Association. and we do the same things that your traditional mental health therapist does. We just also incorporate your faith practices, obviously in Christianity, into our therapy sessions. And I definitely see major changes, turnarounds, and it's just a wonderful experience to be a therapist. I want to talk to you a little bit about that because therapy it's still, even though people are talking about a lot more, I'm so grateful. I'm grateful I see pastors talking about going to therapy. I see leaders talking about going to therapy. Everyone's talking about therapy. But unfortunately, there's still stigma attached to going to therapy. And so I want to talk to you about my experience as a therapist, kind of talk to you about the benefits of seeing a therapist. And as a human being who has gone through pain, what my experience has been going through therapy. Okay. And I went through therapy as a licensed therapist. Okay. Cause you know what I'm saying? It got real hard and I was like, oh my God. And I had some wounds in myself that I didn't realize were there. But the pain was so real. I went to therapy. So and it helped. So I want to talk to you a little bit about that. I'm also going to talk to you about how do you know you're seeing one? You don't want to see an actual therapist. That's number one. I'm going to talk to you about now everyone's like healing. And everyone wants to do it. There's nothing wrong with that. But we have people that want to observe the process and start offering you sessions and they ain't real therapists. Okay, therapists treat mental health and mental and emotional health concerns. Okay, we're going to talk about that. So what is therapy? It's also called counseling. Some people call it psychotherapy, psychology, or mental health treatment. It means the same thing. I added emotional health because it's hard to separate your emotional health from your mental health. They kind of work together. If your mental health is off, your emotional health is off. If your emotional health is off, your mental health is off. So I say the two. Okay, it is a healthcare service for your mental and your emotional health. Okay, it is listen to me, healthcare service. Okay, so just like we all have a physical health, we all have a mental health. So you can't say, I don't have mental health. Well, how are you alive? How are you breathing if you don't have, it's like similar to saying I don't have physical health. How's your heart pumping? How do you have veins in your body if you don't have a physical health? How is your heart going back and forth? How did your brain, it's functioning if you don't have a physical health? When people say, I don't have a mental health, you kind of are saying the same thing, because you can't have a physical health without a mental health. Okay. However, just like everyone does not have a physical health condition, everyone does not have a mental health condition. Okay. So again, just because, we all have a physical health, we all have a mental health, but it doesn't necessarily mean that you have a condition. And also it's important to point out, it doesn't mean because you go to therapy that you have a mental health condition either. It could be you're experiencing life, grief, loss, trauma, things of that nature, but you may not necessarily qualify for a diagnostic. You don't meet the criteria for a diagnosis per se. We're going to talk about that in a minute, but you still need to go to therapy. All right. Okay. Hey, Kenyatta. All right. So we all have a physical health. We all have emotional. This is the makeup of our body. We are all mind. We are body. We are spirit, and we are soul. Now, your body and some aspects of your mind, your medical professionals help you with it. I say some aspects of your mind. I'm talking about like your neurologists and people that really do research and help you medically from your brain, for the brain. Okay, like neurologists and people like that. Okay, if you have a TBI, traumatic brain injury, you're more than likely going to see someone that's medical as opposed to someone that is mental health. Okay, so medical professionals help you with your medical health. But mental health professionals help you with your mental health, okay? Now, I know that's like kind of, y'all may be like, oh, well, duh. We're going to break this down in a minute, okay? I'm setting foundation, okay? I'm setting foundation, okay? All right? So, but therapy, particularly for those that I identify myself as a Christian-based therapist, okay? They don't just help you with your mind, spirit, but they also help you with your soul. So there are three aspects: mind, spirit, and then for your faith practice, those of us who incorporate faith practices, we use the gifts of the spirit, things of that nature. We also deal with your soul. Now, other professionals, okay, who help you with your soul don't necessarily have to be therapists, as you all know. So your spiritual leaders, your pastors, your people, your evangelists, people who are giving you the word of God, those are people who are assigned to also help you with your soul health, okay? Now, for those of us who are faith-based therapists, we are all of that. Not medical. I will talk about your soul healing, your mental healing, and your emotional healing. Okay. So there's some benefits of going to see a faith-based therapist. All right. But again, everyone who deals with your soul doesn't necessarily mean they are a therapist or a counselor. All right. So it is a healthcare profession for my licensed mental health, which is why this is important that a licensed therapist is licensed to bill your healthcare insurance. Okay, so I'm going to talk to you about the process of when someone comes to my agency, but our agency, we do what we call out-of-pocket pay, and we also accept insurance. But we have to verify that we're going to bill your insurance. That is it's called medical necessity, where it's medically needed, right? But in order for us to do that, they're not going to. We can check on our insurance box. Hey, we offer Christian counseling, but there's more to it because they're not going to just pay for that. We have to make sure that your services are medically needed, okay? And we bill your insurance. That's why we bill your, that's why you go to a licensed mental health therapist as well. But a licensed mental health therapist, again, can bill your insurance. Now, all private practice practitioners, which I will talk about in a minute, all private practitioners do not use insurance. And that's not necessarily because it's personal choice, particularly when you start your own business. Sometimes dealing with insurance, just to be perfectly honest with y'all, there's a lot of hoops you gotta go through. I mean, sometimes insurances can be a huge issue, and people don't, practitioners just don't want to deal with, the kind of stuff that we have to deal with dealing with insurance companies. I thought it was worth it because I wanted to be able to see as many people as possible. And I know for me, I have insurance right now, so I'm not gonna go pay out of pocket to see a therapist when my insurance covers it. Does that make sense? But one is not better than the other. Some people have very, very proud, very, very thriving private practice, and they do not bill your insurance, okay? They may give you a bill. You can go and and get reimbursed from your insurance company. Some people just don't do it at all. But again, it's more like a personal choice. Doesn't mean like one is better than the other. And if you get one who doesn't accept insurance, they're more elite. I mean, we've heard this stuff in the field. They're more elite and they're this great therapist and they just don't have, it's just personal choice, and it has to do with the backside of the business and the billing side of our private practices. Okay. So let's talk about this. How does one become a therapist? How does one become a therapist? Now, this is going to make sense. Like I said, I'm building foundation. So a therapist, okay, this is important. A licensed therapist has to have a bachelor's degree, and then they have to have completed a master's degree in one of the following. You can do clinical social work, professional counseling, psychology. There's one called mental health counseling, marriage and family counseling, licensed addiction counseling, things of that nature. We all tend to do the same thing. Our focus may be different. Obviously, addiction counseling focuses on substance abuse recovery and addiction. Okay. What happens is, so we get our master's degree. While we are working towards our master's degree, all of us have to do a internship. Some people, depending upon your program, that internship is more likely going to be 2 years, okay? Or if you do what is called advanced standing, it could be 1 year, but you have to do 2 years, a certain amount of hours, okay? Under a clinical supervisor in a practice, but you're still a student, so you may see an intern if you want to do that, okay? After you graduate, after that therapist graduate, they're not done. Okay, that's help. Here's your degree. You can go do therapy now. Nope. What we do is we tend to get jobs in the field, but we still have to get what we call provisional license. Now, when I when I first graduated, they called it a provisional license. Like we literally had a P in front of our freshly new ink little license. Okay, it was called provisional. It just means someone who just graduated and they don't have their full licensure yet. Okay, now they've changed it, and I think it's called an A. But again, when I was there, it was a long time ago. So now it may be the full acronyms behind the name, but it may say A. And again, y'all, it may be different depending upon that person's, what they went through their school. Okay. But now they call it an associate's license. So associate's license and a provisional license, it simply means the same thing. It means this person is recently graduated from graduate school and they're under clinical supervision. Okay. Now, after they get their provisional or their associate's license, it means the same thing. They still have to submit they have to be under clinical supervisors between 2,000 to 3,000 hours. And I say that because some graduate programs or some schools of thought you have to do 2,000. Some schools of thought you have to do 3,000. For my licensure, we had to do 3,000 hours. Took me a little bit about 2 years. Okay, but you have to be under a clinical supervisor. Now, I'm going to talk about how that works, but you have to meet with that person pretty regularly. I met with my supervisor weekly back in the day. I had to do case vignettes. I had to make sure I'm in line with what the board tells me I think 6 months. I can't believe it was 6 or 12 months. It was 6 months. I had to submit these case vignettes to my actual board. Okay. Now I'm telling you this for a reason, because I'm telling you that when you see a licensed professional, you are seeing someone that is trained, okay? That is trained to offer treatment, okay? So after the 3,000 hours, then we had to we had to have another test, okay? That test, once you pass it, then you get your full licensure, okay? So I got my full licensure 11 years ago. So that means, I think 2008, I was provisionally licensed for 2 years. I had to get 3,000 hours. I was under a clinical supervisor during that time, okay? After they sit for the license, they pass, they're fully licensed. Now, once you're licensed, okay, this is going to make sense in a minute. It's going to make, it may be boring to some of y'all, but it's going to make you feel good as it relates to somebody that's fully, truly trained to offer you counseling services or treatment, okay, particularly for mental health or emotional health, right? So, got my full license. Got our full license after those 3,000 hours, 2-3 years, okay? Passed my clinical exam. That license is not terminal. When I say terminal, it means it doesn't last forever. Your license is not forever. It must be renewed every 2 years. Every 2 years, you don't have to specific another test, has to be renewed every 2 years. And in between those 2 years, a therapist has to have 40 CEUs, continuing education units. Okay, 40 of them. Okay, 4 of those have to be ethics training, okay? So that you make sure that this therapist is in line with their ethics, okay? And that's what we have to do everything. We have to pay a fee as well. So we have to pay for these CEUs. It's money, y'all. We have to pay for these CEUs. But we have to, submit to our licensure within a certain amount of time. Okay. So I got my license. Once again, my license is back here. You can't see it because there's the glare. That's a copy of my license, not my actual license. Okay. I just keep copies, and I have my copies. My real license is somewhere hidden, but I keep copies up. All right. And that's it right there. Copy of it right there. Okay. Okay. So, but that's every 2 years. This is why this makes sense. And I'm going to talk to you about this in a minute. Therapy is hot topics now. Trauma, recovery, all these things. We have people who, and I'm not digging on anybody who don't want to submit to the process of becoming a therapist. They think it's too much. I don't have a problem with submitting to my board. I'm in good standing with my board. I've actually talked to a few of the board members, not a whole lot, okay? We don't, because there's so many licensed therapists, and they don't have the time to have a personal relationship with me. We're in good standing, okay? By the way, a therapist license is public record. Now, so if you Google my name, my license and my license number will pull up. Now, my personal information, my home address, and personal information won't pull up, but my full licensure will, and it'll say in good standing. Okay, that simply means I've never had my license in probation. I've never had, stuff like that, okay? But again, becoming a licensed therapist or therapy is hot. It's starting to become hot now. There's still stigma, but it's hot. So people say, I want to do what you do, Samira. I want to do what you do. But they don't want to submit to the process. So guess what? A licensed coach. Now again, I'm not against coaches. One of my favorite people, two of my favorite people in the world are coaches. I love these people. Amazing. Do great work. One of them does business coaching. Phenomenal. Okay? Otherwise, more like motivational. Amazing. Driven. Crazy good. Some of the people that we love are coaches are amazing. Nicole Nichols, I think it is. Not Nicole Nichols. I can't think of it. Lisa Nichols, excuse me. Les Brown. These people are phenomenal. This is what we see in the mental health field. People say, I want to do what you do. I want to help people heal. I want to do soul healing. And they go and they want to become a licensed coach because they don't want to submit to the process of becoming a licensed therapist. Because you figure it's a lot of work. You can become a licensed coach in 2 days or less than a week. You don't need any professional or academic training. Very little training is required. But again, there's nothing wrong with coaches. I don't want people to misinterpret. Coaches do excellent job. They give you motivational services. They help to motivate. They help to get you unstuck. But when you have people that are saying, I am a licensed coach and I offer trauma advocacy or trauma coaching or trauma informed, you dead wrong. Period. Because trauma is a complexity of the mind, the body, and the spirit. And it only should be addressed by a licensed therapist. And what people do, they observe the process. So they say, I'm gonna do trauma advocacy, but you offering coaching services to do trauma work. Dead wrong. Dead wrong. Period. There is a plate, like a therapist is a masterful clinician. They almost have precision. They have to take your emotions places, and they have to be clear about where we're going, and they have to be trained to do that. If I went, therapists go to sometimes 8 to 10 years. I went to school much longer than that, obviously. They went to school 8 to 10 years to understand the complexities of how to treat someone who experienced trauma. And you want to do it because you have experience? And you go through a 2-day certification? Dead wrong. Period. So I'm going to talk to you about the professions that I went through that because I want you to see it's kind of like if you need brain surgery, right? If you need a brain surgery, you want to go to a brain surgeon, right? Yeah, right? Do you want to go to a brain surgeon who got their certificate in 2 weeks or in 2 days? No. Again, I love coaches, but I'm telling you, we're seeing this phenomenon because there's still stigma. People don't want to go to a licensed mental health therapist, even though their insurance covers it. Because I can't admit that, but there are people who say, I want to do what you do, Samaria. Let me get it. But just submit to the process. Okay? Well, I forgot to, there are people who we call LLCs, LCC, licensed clinical Christian counselors or Christian counselors. Now, again, let's talk about Christian counselors in a minute. Let's talk about it. So everyone who's a Christian does not necessarily mean that they are fully trained with mental. There's different complexities within the Christian counseling world, but you don't necessarily know how to diagnose mental health or emotional health treatment. You want to make sure if you're going to go to someone who said that they're a Christian counselor, they need to have a master's degree or a PhD in Christian counseling. Okay, let me say it again because I talk fast. They need to have a master's degree and or a PhD in Christian counseling. There's some schools of thought where they will give you a 6-week certificate. All you do is take 4 classes and they give you a certificate, a big old certificate. It looks like it's a PhD, but it's really not. And it says Christian counseling. No ma'am. That's a 6-week course. I need you to get a master's degree. You see what I'm saying? Or a PhD in Christian counseling. Okay. Because that's when someone's really sat down. They've gotten a lot of training. Some of the schools that they go through, even if it's not necessarily a K-CREP, they still have some kind of mechanism where you have to learn the complexities of how to effectively counsel people. All right. So I forgot to mention that up front. Okay. So you can see why us as therapists, we're like, oh, because I worked with many people who have experienced trauma, okay? And I just could not imagine the complexities of dealing with someone who has been abused over and over and over again. You really truly have to know how to take someone into depths of healing, when to stop, when to hold off, when to just build them up. You have to really know that and you have to sense that, but you don't know that if you're not trained to do that. You cannot just trigger someone's trauma and think it'll be okay. Okay. We don't do that. Therapists tend to build you up, help you to build coping mechanisms. And then we go deep as it, and I say as it relates, depending upon the complexities, depending upon how far we can take you, okay? There's a difference. But again, you learn that when you are properly trained, all right? So how do you find a therapist? This is going to be good, y'all. Write this down. Number 1, your insurance card. Call the back of your insurance if you have it. We're going to talk about those who don't. And just ask them, hey, I'm looking for a licensed therapist. I want them to also understand whatever it is you want, marriage and divorce, grief and loss, but you also want to emphasize Christian counseling because most insurance companies, we have to let them know the type of counseling that we offer, depression, anxiety, all these kind of things. And then there's also a place we can also select Christian counseling. Okay. So just call the back of your insurance card and they tend to give you a list of referrals. They can just give you a list of referrals. They can refer you to somebody. They can call someone for you. We get referrals from insurance companies all the time. They're calling, hey, we're looking for Samaria Kingdom Creative Counseling. Are you available? Do you are you still accepting clients? I mean, obviously I'm still accepting clients, but they'll call you up and sometimes they'll even schedule appointments for you. But again, it's depending upon your actual insurance. Then there's a service called the EAP. EAP, I get a lot of referrals from EAP. EAP stands for Employee Assistance Program. Now, this is a company-sponsored service. Just because it's company-sponsored, though, does not necessarily mean that your company is not aware that you're using the EAP. What companies now recognize is that many employers recognize that their employees experience stress, anxiety, worry, they go through divorces, they do the same thing they do the same and they experience that, okay? And so they connect with or outsource, and I don't know what you call them, like EAP sponsored businesses, and they help to pay for your service. So you would call your HR, or you can look on the back of your card and most companies, legit companies, will give you certain EAP benefits, okay? Now, some of it's different. I've had people that the company pays like 3 sessions or 5 sessions or 8 sessions. But again, we do not communicate with your employer. It is still confidential, okay? It is still confidential. Your employer is most like contracted with an outsourcing EAP company, okay? And so a lot of people are able to get services through their EAP. But again, it's usually supposed to be short term. I've had clients that come in and use their EAP. Maybe they have 3 sessions, maybe they have 5 sessions, maybe they have 8 sessions. Some had 16 EAP sessions. I was like, what? 16? but you don't have to pay out of pocket for those, okay? Again, and some, like, say, for example, you meet with therapists such as myself. You say, hey, I had 3 EAP sessions. I see that you're in network with that. Can I see you? And I say, sure, we can see you. Then they say, what if my EAP sessions run out? I always tell them, well, tell me what your health insurance is. So what happens is you may have 3 EAP sessions, you use those up, and then we may switch to your Blue Cross Blue Shield, your United Healthcare, whatever is your primary, what your insurance is, okay? Or, you can, some private practitioners, bill, out of pocket, okay? And I got ahead of myself. I said, how do I find a therapist? I'm talking about funding. We're going to go back to that in a minute. I got ahead of myself. So you can contact your EAP, basically, and they will get you connected with a therapist, okay? Other places you can find a therapist is Psychology Today, therapyforblackgirls.com. You can just Google therapists in my area. We are available via Google. A lot of times your primary care physician, if you tell your primary care physician, hey, I'm experiencing depression or anxiety, I'm really stressed out. Your primary care physician has a mechanism that they can, so I get a lot of referrals from primary care physicians, okay? And that was, again, I got ahead of the funding part, so I'm going to go back over that in a minute, but we talk about how do you find a therapist, okay? We're going to talk about funding sources in a minute. Again, let's go over that again, because I got a little ahead of myself. Your insurance card, call back your insurance card, your company's EAP, okay? I get a lot of referrals for them. We said Psychology Today, Therapy for Black Girls, word of mouth, ask a friend, hey, I know you go see a therapist. What therapist do you see, or something like that? Google primary care physicians, just to name a few. And again, if you Google, just say therapist in my area or Christian therapist in my area. Okay? And we're going to talk about funding sources in a minute, like how do you pay for it? Did I say that? Okay, so let's talk with it. So let's talk with it real quick. Again, I know I said this again, y'all, but I kind of got ahead of myself. We said your insurance pays for it. Your EAP will pay for it. Those are sessions that you don't have to pay for. You can pay for out of pocket. There's another source. There is a program by Taraji P, and I don't have her. Taraji P. Henson has an organization called the BorisHensonFoundation.org. If you get connected with them, they will pay for some sessions as well. The last time I checked, okay, that may have changed, but go to BorisHensonFoundation.org and see about that. Also, a lot of people don't know this, but in the state of North Carolina, there is a grant called the IPRS. I forget what it stands for. And what that is that the state gets funded a certain amount of money to offer some type of treatment services to individuals who have no insurance. It's called IPRS. Now, every practitioner does not have access to this grant. Most of the time, it's going to be your community mental health agencies that have access to the grant, okay? They will pay up to 8 sessions. Now, we're not supposed to tell you it's free. They will tell you it's at a at a reduced rate you can get services. So if you can only pay $10 towards your services, the state will pay for the rest, things of that nature. However, it has been my experience when I work for these agencies that we did have people who come in who said, I have no type of resource. I can't pay you anything. We would still be able to see them because of the IPRS funding. Now, again, these are only for people who do not have health insurance. And there is a way to look up to see if you have health insurance. So if you got your health insurance, you can't say, I don't want to pay my copay deductible. It's for people who do not have any type of insurance, okay? But again, you want to, how do you get a hold of that? Contact your local local mental health clinics. Okay, and they have the grant. You can just, again, Google managed care in the area, and they will get you in contact with them. But usually your local mental health clinics have that grant, okay? And again, they pay up to 8. It's renewed every year, all right? And some of them I know are Monarch, RHA Health Services, I'm on Piedmont Behavioral Health. I'm not sure about Trinity Behavioral Health. I know they used to have it, but I'm not sure if Trinity has it as well. But again, if you're in a different area, these may not make any sense to you. But again, look at your local areas, okay? And if you're out of the state, I know in Maryland, they used to have something similar to that. I'm not sure about those who may watch this outside of the state of North Carolina. I can only speak to them, but also research that, because a lot of times this is something that is funded through the state and what their funds are allocated for. But again, if you're like in Vermont or something like that, or Maine, or I don't know, Texas, I don't know. But look at your community clinic mental health agencies, okay? So hopefully, and again, also look at Taraji P. Henson's organization. It's called BorisHensonFoundation.org. I do know of a few clinicians who have contracts with that organization, and they will help to pay for that. Now, it has been my understanding, again, I don't know this, but some of my clinician colleagues have said they don't get a lot of referrals because a lot of people don't know about it. So again, look it up. I'm not sure if they've changed that or if that was in the past, but they do help with funding and getting people resources as it relates to mental health, okay? So that's BorisHensonFoundation.org. All right. I got ahead of myself. Okay, so we're almost done. Actually, no, we're not. We're just halfway done. How do I know I need to see a therapist? How do I know? Let me just say this. We're going to talk about stigma in a minute, but you need to just let go of stigma. Let go of it. I think that people think that if you need mental health services, that I don't know, they had this weird 1900s mentality. It used to be that people who had mental health conditions or even medical conditions were treated very, very badly. So if you had like leprosy back in the day during the Bible days, you were shunned. It's the same with mental health. When you had mental health conditions back in like the 1900s and 1910, you know what I'm saying, 1950s even, you were treated very, very differently. And I think that people have not gotten this idea of who has a mental health concern or emotional health concern. So you're thinking people who are crazy and have in the straight jackets and foaming at the mouth, and you thinking, well, I'm not that, so I don't need to go to counseling. Well, that's not realistic. You just think of people in straight jackets and foaming. Like that's not really the clients that I see. I can't tell you how many times I have clients to come in and say, listen, I'm just here. I'm not crazy though. Like I'm like for real, I'm not crazy. I'm just, I just got some struggles. I'm like, no, it's cool. If I tell you this, will you send me to the hospital? No, like calm down. It's fine. Like you good. So how do you know need to see the therapist? Any area of avoidance. If you are avoiding. Now let me say this. I come across people as a therapist who I know dead on they need to see a therapist. Like you are different. And it's because of avoidance. Now let me clarify this. Just because I meet people and I think, gosh, they need to see a therapist, don't necessarily mean I want to be your therapist. No, you need to see a therapist. But avoidance, what do you mean by avoidance? You avoid people. You have a history of not trusting people. People can only come but so far. They only come this far to you, and you have you're guarded. Avoidance. If you chronically and historically and have a pattern of avoiding people, you may struggle with something. Anxiety may be one of them. Fear may be one, or you have an underlying emotional wound that you never got hold from. Okay? Any type of distressful life event. Again, another reason we're having this discussion about coming to therapy is because of so much that we've experienced. You got one thing after the other thing after the other thing after the other thing. I mean, 2020 has been a year, but 2021, we have not gone back to normal as the prophets prophesied. So some of us need to go to therapy. Okay, because it's hard to come to terms with all this stuff. Reoccurring issues, unresolved hurts, denial. Listen to this, denial. And I tell my clients this all the time. And they receive it, even though it's staying in love. Denial doesn't make it go away. Let me give you this analogy. Because a lot of times when you tell people somebody to come to therapy, they get offended. But let's relate this to your medical health. Let's say, for example, you are walking around and you got a big old gash on the side of your arm. It's bleeding. It's bleeding. People around you are like, oh my goodness, it's bleeding. You try to bandage it yourself. You try to peroxide it yourself. You've done everything that you know to do, but you're still bleeding. People around you may say, you know you're bleeding, right? You need to get that checked out because you can bleed out. What would you do? Would you be offended? Would you like, nah, what's wrong with y'all? I ain't got nothing wrong with me. But you're bleeding. You're bleeding so bad. You're bleeding on other people. Other people can see it. I don't want to see blood. I need you to go to the doctor because I don't want to see your blood. Like, I need you to get that fixed. Well, here's the thing as it relates to your mental health. There's some people that we know that you are bleeding. We don't physically see you bleeding, but mentally, emotionally, your behavior, you're bleeding. You're bleeding on people. People are around you, don't want to be around you. Every place you go, there's a pattern of instability. I'm not knocking it. I'm telling you, we got to call a thing, even as a therapist. You're bleeding, and people around you are seeing it, but this is the difference. This is the difference. The difference between the physical versus the mental. The physical, people are more apt to tell you, you know you're bleeding, right? But the mental, they don't want to offend you. So we know you're bleeding. Your friends know you're bleeding. Your mom know you're bleeding. Your girlfriend or boyfriend know you're bleeding. Everyone doesn't, you know what I'm saying? People around you know that you're bleeding. Sometimes they don't want to tell you. Sometimes they do. But we don't want to admit, I should go to see a therapist. Why? Because of stigma. We're going to talk about why in a minute. So you have a pattern of instability, pattern of unstable relationships. You're going from one relationship to the next relationship to the next relationship to the next relationship. If you know, that is an indication. Anytime person, again, back to the avoidance, you are hiding. Okay, you keep everyone in your life at an emotional distance. Okay, everyone at an emotional distance. No one can come to but you so far to you. That's another form of avoiding. Okay, but even if the people that you're not necessarily, let's say the people you interact with, you may interact with only surface people. You never interact with people who somebody may be able to see into your heart. That is an issue. Okay, low self-confidence. Anytime you have any extended anxieties, fears, feelings of overwhelm, depressions, trauma, chest pains, believe it or not. So let me give you, we always want to rule out what we call rule out medical. So what does that mean? That means that if you have a physical sensation, you want to make sure it's not medical. However, I've gotten referrals like where people go to the hospital, they say, I'm having chest pains, I think my high blood pressure is up. And the hospital goes, does their workup, whatever they do, and they say, oh, no, your heart's fine. If that happens more than a couple times, and they say, no, your heart's fine, we Mr. such and such, or Sister such and such, whatever, women, female, you're fine, but you keep having, a lot of times it has to do with you having panic attacks, or you're overwhelmed with stress. Okay? Sometimes you can be so stressed out, physical sensations, you have reoccurring headaches, you have migraines, your hair is falling out. Okay, you're having chest pains. Again, we always rule out medical. So I'm not telling you don't go to your doctor, just go straight to your therapist. I am saying if that keeps happening over and over again, and the doctors are saying we keep doing this same, MRI, whatever you call it, or X-rays. I'm not sure what the terminology is, and you fine. It's probably more than likely, and doctors will catch on to that after a while. They'll say, hey, you need to go to this organization because we think that you're experiencing extreme anxiety. Okay, there are some mental health conditions that will impact your physical body, like how you physically feel. Okay, any history of traumas. Again, trauma is a trigger word here, but any issues of trauma. You recently broke up with a controlling person. Okay, and it could be years ago, but more than likely you still have the effects of that person, or you're still in a relationship with someone that's very controlling or manipulative. Or trauma. Last 2020 was a traumatic year. You've lost people over and over and over and over again. I mean, just one thing after the other thing after the other. And I think we as a nation experience trauma just as all at once. And so now again, we're seeing a lot more people who are willing to come and deal with trauma. People who lost friends, families, sisters, brothers. This epidemic that went ahead in Texas, these things, it affects your psyche. And what happens is with trauma, your mind goes to fight or flight. And generally it's supposed to come back down, but when you experience trauma after trauma or chronic trauma, it goes up like this in that fight or flight, and it does not come back down. Okay, so it stays up. And so you need help of a masterful clinician that can help you to bring you back down. Difficulty coping or a history of unhealthy coping, okay? Any type of addiction. Okay, internal or external conflict. You will constantly have conflict with other people, okay? Or internal conflict. You don't like yourself, but I know people like this, and the true story, y'all, like, it's, as a therapist, you can't help everybody, okay? But I know people outside of my therapy world who, like, have constant conflict with people. I'm just one of the ones, but it's like one person, and it's always somebody else's fault. You know, if you, I had someone I was working with years ago. Every session she came in to marry, and it was always something. I'm like, oh my goodness. And we would work through that thing. But after a while, I just kept thinking, well, you sister? So we had to change the scope of therapy because this is something right here. You know what I mean? So, reoccurring nightmares, grief and loss, any history of generational curses, believe it or not, history of generational curses. So mama and daddy and brother and grandma and great grandma. Again, your therapist should be able to discern that. Now, in the secular world, they call it the intergenerations of poverty. In the Christian world, the inner healing world, they may do that. We just call it generational curses, okay? And we use the spiritual concepts to break that. Repeated history of toxic relationships. You refuse. Some of y'all responded. I'm actually going to do a live on that. Talk about red flags. You have a chronic history of going from one relationship to the next relationship, and you don't learn red flags. Or guess what? People around you, if they be honest, they just tell you, listen, sis, I love you, but you need to go to therapy because it's a lot for you to deal with. Let me tell you this. The difference between going to therapy, again, therapists are trained to deal with different things. But the difference between going to a therapist and your friend, obviously, is because we're trained, but sometimes your friend will give you a biased perspective. So if you're in a relationship that's technically unhealthy, but your friend, I see you being single for 15 years, and she wants you to see you in a relationship, you can say, friend, what you think about this? Well, she's not really a therapist. She has a biased opinion. Girl, it ain't that serious. You just tripping. Like, you see what I'm saying? And the reason why she's doing that, friend, is because she's a biased opinion. But me as a therapist, I don't have an opinion about whether or not you should be in a relationship either way. Like, I wasn't there when you was crying when you went through your last relationship. You understand? So I can give you an unbiased, not opinion, but I can give you an unbiased perspective. And I can also give you signs and symptoms. As a matter of fact, I can't disclose with my client's information, by the way, but I'll give you an example. I was meeting with somebody and she was like, so she was going on a certain behavior that someone else was exhibiting. And I was like, yeah, let me tell you this. I was like, so does she do this? Does she do this? I said, yeah, I said, you are dealing with someone that has a manipulative spirit. They're very controlling. We went down. He was like, yes, yeah. One of these, yeah. I didn't know. Like, you see what I'm saying? But I'm like, so this is because we study human behavior, okay? We study this, and so we can kind of pinpoint why someone does this and does that. And we were like, she's like, yes. Girl, oh my, you know what I'm saying? And it was fun for me. It was fun for her. But just that having that experience, I would imagine, helped her to feel like, you're not the crazy one, right? Sometimes, and this is true, y'all, we will go to therapy. People go to therapy to deal with people who refuse to go to therapy. You come across the wrong person and they just are so toxic. They just drain the life out of you. Sometimes you got to go to a therapist and be like, help me, please. Okay? The wonderful thing about therapists, again, we're unbiased. We are obligated by the law, people, the law and our license to protect confidentiality. So HIPAA stands, I wrote it down, said Health Insurance Portability Acceptability Act. That means everything that we do has to be confidential, and it has to go through a HIPAA compliant system. Okay. So our EMR, our electronic medical records, how we see you. We can't offer, that's how you know when someone's really not a real therapist too. They say, oh, we'll offer you therapy session over Skype. Skype is not a HIPAA compliant service. We'll offer you sessions over Facebook Messenger. Facebook Messenger is not a HIPAA compliant service. Okay. We'll offer you sessions over, FaceTime. FaceTime is not a HIPAA compliant healthcare service. So you know when somebody does it, they may not necessarily be a real therapist. Okay. We're going to talk about that in a minute. Okay. So again, we go on. But again, you denying it does not make it go away. Now, notice I didn't just hit all the mental health stuff. I just hit like emotional stuff, like emotional wounds. Like avoidance, that's not like a mental health issue, that's an emotional wound. Okay, now it could cross over to you having some anxiety, but once we deal with the emotional wound, the anxiety may go away. More likely it will, okay? Difficulty in relationships, that's not a mental health issue per se, that's an emotional issue. That's why I say emotional and mental health, okay? So what should you look for in a therapist? And again, I talked about licensure, LCSW, licensed clinical social worker, LCPC, licensed clinical professional counselor, LCMC, licensed clinical mental health counselor, a licensed psychologist. Some people call it a psych D or a someone with a PhD in psychology, licensed clinical addictions specialist. Okay, those. Now, can I get to go on? I'm gonna put this just that under the description box for those who don't know. Okay. So what should I look for in a therapist? Don't necessarily focus. You do want to see what's behind their name, okay, to make sure they're a real therapist. Again, because we have people who just want to be through therapy and they don't want to go through the process. However, what should you look for? Focus. You want to look at that, but also look at, you have to identify, one, what are your needs? And you want to find a therapist who specializes in what it is that you need, because there's so many different complexities of the human psyche. It's one person's not going to be able to know it all. Okay. For me, my background was trauma. I always for years dealt with trauma. I still deal with trauma. However, I also opened up another door for me a few years ago, and I also started counseling ministry and business leaders. Okay. So your entrepreneurs, your other therapists, your ministry leaders, people have leadership positions or callings on their life. I tend to be attracted to these people. Okay, that's why if you look at a lot of the books that I've written, all of them are leadership related, and I also talk a lot about the emotional stuff within those books. Okay, so again, you also want to identify ministry people a lot. Ministry people really need counseling. Okay, I'm not knocking. I'm not making fun of people. I'm just telling you that when you deal with the complexities of other people, sometimes you need to go to a therapist yourself to be able to process through all that. Okay. So are they a real therapist? Okay. If they say I'm a licensed coach, I offer coaching services for trauma. I'm a trauma advocate. I'm a trauma informed coach. I'm a depression informed coach. Anything that has to do with your emotions that go back, that's not really a real therapist. Okay. And you want to go to a real therapist. Okay. So identify what your emotional needs are. You also want to look at the therapist. I have a lot of therapists. I'm an African-American woman. Okay. And a professional woman. So guess what? I tend to attract African-American professionals. Okay. How do you find a therapist also is their websites. This is why I encourage therapists. Like, I don't understand why your therapist, you don't have a website. when it comes to your emotional space, when someone's going to have to open up, talk to a complete stranger about their stuff that they may have never told anybody, they're going to research you. They may not say it, but they're going to research it. I can look into the backside of my websites for counseling, and it tells me the numbers of people that look me up. Okay. So people that necessarily be online talk about, hey, Samaria, boundaries. They may not necessarily know me online, but they look me up. Okay. And I've had clients who say, I looked at your website. They gave me your name. I Googled your name. So if you're a therapist, like, come on, y'all. Like, the first thing you do is have a website. As a matter of fact, when you're filing your PLCs and your LLCs, and even for insurance credentialing, they ask you for your website because they know people will look you up when it comes to your emotional space and your mental health. People want to look you up before they jump in. You understand what I'm saying? And so we have to do that. So look up their websites, okay? Now, you can also seek consultation. Now, this is important. I posted on someone else's wall. Just to clarify, I wasn't being mean. They were talking about what you should ask at your consultation. This is the thing here about consultations. A lot of therapists do them. I do not. Every therapist does not do a scheduled consultation. These are like the times where you meet with a therapist outside of an actual therapy. You ask them questions about type of therapy, the orientation, how long they've been in sessions and things like that. You can, some therapists will schedule like a 30-minute free session. I don't do that, but you can always ask about it. Now, what I do as an alternative is, like, if you call me and you say, hey, I've heard about your counseling service. Can I talk to you for a few minutes? And I'll take 5 to 10 minutes out of my day and talk to you, which is like your 5 to 10 minute consultation. So I'll explain. I don't have to explain. Let me tell you why I do that, because even though you tell people in advance, it is not a therapy session. Sometimes they end up liking you so much, which happens most of the time, it ends up turning into a consultation, a therapy session. So I'm going to, you know what I'm saying? It's just hard for me to bring people back. And then turn around at the intake, ask you the exact same questions that I just asked you at your free consultation. The other thing is that because for me, I had clients coming in so much that I couldn't block out a consultation session, it wouldn't be fair to a paying client to have to wait an extra week or wait a few more days because I have a consultation for free when they're a paying client. I have to prioritize my paying clients. So that's why I don't offer people like 30-minute consultations. Some therapists do, but also I say that because remember, it's a courtesy. It's not necessarily a mandate that every therapist who meets with you will give you a consultation. Okay, like I said, me, it's more 5-10-minute phone call. You can ask me different questions, but I'm not going to do a 30-minute schedule you a session because I have to reserve those slots for paying clients. Okay. What else I was going to say? Oh, your community mental health clinics that you go to, for those who decide to go that route, they do not offer consultation sessions at all. They just don't. Also, if you go to, like, I have a small base business, but if you go to more like your bigger agents that have multiple staff and things of that nature, most of the time they don't really do it either. And again, it's just because of our time and the limitations on our time. We have to prioritize. Clients that are paying, and not necessarily have them wait much longer for a follow-up session or an intake session to prioritize a free session. Okay. But you can ask about that, and also visit the therapist's website. That tells you a lot. Not most of the questions that you ask, more than likely, if a therapist has a good website, will be answered by that. Okay, look at your area of specialty. Look at their area of specialty. Is it in line with what you want? If you need a trauma therapist, you want to go to a trauma therapist. If you need trauma work, you need to go to a trauma therapist. If you're experiencing grief and loss, you need to go to someone who specializes in grief and loss. Most therapists, we can do a little bit of everything, but it doesn't always work out that way. Like for me, I've worked with a couple of clients who have eating disorders, but because that's not my area of specialty, I may not necessarily be the best person to work with who have eating. If your primary concern, is eating disorders, because I don't specialize that may not necessarily be the best fit. However, I've had clients who say, I need faith practices, I need a faith-based counselor, I need to see you. Okay, and I disclose that information in advance, and I also, as appropriate, have to make referrals. Okay, and you also want to look for therapists who have similar values to you. Okay, similar values. And that's okay to ask them. Now, a therapist, we do have professional boundaries. So a therapist may not necessarily tell you all of their personal business because it is a professional boundary. Just like I don't know my primary care physicians, I don't know whether or not she's married or have 3 kids or something like that. Like, it doesn't really matter to me. But also understand it's a healthcare profession, so they may not necessarily disclose to you of things they have personally went through because it's a professional boundary. Okay, we are professionals, we are healthcare professionals. So can I be a Christian and have a therapist? The answer is yes. Let me look at my time. My time is almost up, y'all. Can I be a Christian and have a therapist? And the answer is yes. Proverbs 11:14 says, "In a multitude of counselors there is safety." Proverbs 11:14. "In a multitude of counselors there is safety." Proverbs 25 says, "Counsel in the heart of man is deep water, but a man of understanding will draw it out." Again, it's Proverbs 20, verse 5. A man with understanding will draw it out. So your therapists are the man or woman of understanding, because we've been trained, we've been developed, and we operate in the spirit of wisdom to help to draw it out, to bring you to a place of healing. Do I have to see a Christian therapist? And the answer is no, you do not have to see a Christian therapist, okay? Therapy is not the same as church. So if you're going to see a therapist and you're expecting, you may not necessarily expect a full-on deliverance service, even though that's a form of healing as well. You may not necessarily get the same experience what you do when your pastor's laying hands on people and you falling out, okay? No, don't get it twisted. We spirit-led, spirit-fed. If it comes to that now, we can do it, but that's not that. That's not that, okay? Again, a spirit-led therapist, aka such as myself and my other colleagues within the field. I'm not the only one. I can only speak for myself, but I know so many other people that do great work. They also operate in spiritual gifts. Your traditional, maybe therapist who's not as may not necessarily have a spiritual orientation, may not necessarily operate in gifts of the spirit. Some of my primary ones are, I don't know, y'all, I can't stop. I'm getting tongue-tied today. I can't speak. Hold on. Okay. So therapists such as myself, we do operate, like one of my primary spiritual gifts is the word of wisdom, also word of knowledge. Okay? Now, when I'm operating gifts of the Spirit, it's not church. It's conversational. So I ask questions in a way, according to Proverbs 25, that draws you out. It's not, in the name of Jesus, I feel in my spirit, I feel in my spirit that you have been abused. You know what I'm saying? It's not church. It's conversational. And so when I train as a therapist, I tell them that you have people from all walks of life, all different orientations, okay? A real good therapist can meet with anybody, okay? And sometimes people who don't go to church, don't want to go to church, and ain't trying to see hear nothing about church, okay? But we don't impose our belief system, but we also help to work people to work through their own healing, okay? But it's not church. So a lot of times people are like, how do you know that? Oh my God, but I'm not freaking them out. There's no music playing. There's no drum. There's no drums. There's no organ. Da, 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 da. There's no E flat or B flat or whatever flat it is. And how about shata de kosha? I feel it in my spirit. Oh God, it's going to, it's therapy, okay? Now let's talk about inner healing, okay? I'm almost done, y'all. Y'all not gonna like me on this, but I'm gonna go ahead and tell the whole truth. Before I answer this, is inner healing counseling or therapy? Now, before I answer this question, y'all not gonna like me, but it's okay. It's okay. I'm ready. Is inner healing counseling? Now, before I tell y'all this, let me just tell you about me. I'm the only therapist, to my knowledge, that has a full-on training courses, okay? Because I think it's about 20 hours long, 16, 20 hours, that introduces inner healing in clinical settings, okay? I'm the only therapist to my knowledge. I say to my knowledge because I don't know every therapist all around the world. I offer inner healing in counseling practice, and I have a training for that. It took me a long time. It has a training course for therapists. It is a little expensive, but I promise you it'll bless your practice. www.seminarycobra.com has a training course, has a book. I think one regular workbook, a group manual if you want to do inner healing in groups, and then I have a training manual. It looks like a textbook that I did, and it's an online course that comes along with it. Okay, I'm the only therapist who introduced inner healing in clinical settings. And the reason why I say it is not because I want to brag, because I want to tell you that before I preface this statement is that I have done a ton of reading, studying, and training in the area of inner healing. Okay, in the area of inner healing. Okay, because I realized, I can really help my clients with that. So, is inner healing the same as Christian counseling or therapy? The true answer is yes, it is. Inner healing is a form of Christian counseling. Now, all form of Christian counseling does not mean it's mental health counseling, but it's a form of Christian counseling. Okay? Now, for those who don't know, when we do therapy, there's different orientations. You can do cognitive behavioral therapy. You can do Christian cognitive behavioral therapy. You can do psychoanalytic therapy. You can do DBT therapy. You can do emotional focus therapy. There's different orientations. Inner healing is one of them. This is my problem with inner healing. We have people who can get a certificate in 4 hours and do inner healing, but you're still dealing with the person's emotional and their mental health. Whether you want to deal with it or not, you are dealing with that person. You should not get a certificate in 3 to 4 hours and say, now I can offer the same services. Absolutely not. And again, I talk about this in my training course, how, again, you have to be masterful at taking someone, and being able to not take someone where they're not ready to go. Okay. Inner healing is like going to the root, pulling it out. The reason why most people do that, again, they absorb the process. And the founders of inner healing, to be perfectly honest, were not necessarily, they were Christian counselors. They weren't necessarily licensed mental health counselors, but they were still trained in some kind of counseling practice, okay? That's why you can see people do inner healing and they're not necessarily a LCSW or something like that, okay? But again, when I look at the orientation of what inner healing does, it is a phenomenal job of helping people with emotional and mental health wounds. My issue is not in the context of inner healing. My issue is that we have people who are not really fully trained. You should not be able to do inner healing and you just have a 4-hour certificate. Okay? It is one of the orientations, a 4-hour certificate. That's not enough. Okay? And then people do that. They just do. Again, absorb the process. But when you open up a wound for somebody and they're not ready, they can't handle, they're very fragile, their emotions, their spirit, their psyche is very fragile, you can damage them even that much further. Okay? So I have a problem with that. Just because you have experience going through hurts and pains does not mean I want to do counseling. Let me get a 4-hour certificate or a 2-day certificate to help people with deep-seated emotional wounds. What should you do, Samaria? You can go to a therapist such as myself or one of my colleagues, okay, in the field, who are trained in the different complexities of the human psyche and walk you through that healing process. Now, what I said about in my training, there are 3 different ways in which we can offer a counseling. There's mental health counseling, there's inner healing counseling, and there's deliverance. Okay, deliverance tends to be what your ministers do, casting out demons and things of that nature. Okay, a true now spirit-led, such as myself and one of my colleagues, we can do all 3. Now, again, because I'm a licensed therapist, people come to me, I can do inner healing and I can do mental health at the same time. Or sometimes what happens is we go through, I may not necessarily go deep first. We may do one thing, we go do inner healing on that, we come back up, we do another thing, because there's a complexity there. People have multiple issues going on. Okay? And so we may do one thing, we go ahead, we start doing inner healing, we take it out, we uproot out, then we go through, and we do something else. Okay? All right? So it is a counseling practice, but again, if someone's I do inner healing work, you want to ask them, do they have a master's degree in counseling or some kind of counseling practice, and how long they've been in practice. And if they just say, I just do inner healing, or they got a certificate in 4 hours or 2 days or 6 weeks, that's probably not somebody that is fully trained to deal with your issue. Okay? This put it on out there. All right? Now, I'm past my time, but I don't want to do part 2, so I'm gonna keep going. 2 more things here. What can I expect from therapy session? Now, again, I'm going to tell you how we do it in our practice. Every therapist or private practitioner is going to be different. You can go to a community clinic or you can go to a private practitioner, okay? They have the same kind of credentials. It's just about what your preference is, okay? And it's what your preference is, okay? I'm a private practitioner, Kingdom Creative Counseling is the name of my company, okay? So you have to fill out an intake packet. What's an intake packet? So my intake packet, first, is like 3 forms. One is your demographics, your name, your address. We have to verify your insurance or your EAP or how we're going to get paid, okay? Your emergency contact person. Now, let me just say this. I don't know how many times people don't understand that I'm a healthcare professional. My organization is a healthcare governed system, and you have to complete an intake packet. And I have to explain, like, when you go to your primary care doctor and it's your first time, and they hand you I don't have a clipboard. They hand you a clipboard with some information you got to fill out. Or you go to your dentist. I went to my dentist, I think, on Tuesday. They gave me a virtual packet that I had to fill out, okay, online. When you go to see a therapist, you have to do the same thing. I cannot tell you, this has been the vein of my existence. How many times I tell people, you have to fill out the intake packet. You have to fill out it. Okay, email you. Did you fill out the intake packet? I remember one time I had a client, I had to tell her 6 times, fill out the intake packet. Oh, I don't, what you do? Oh, I'm not paying, this is not through my insurance. Man, you have to fill out the intake packet. This is not through my insurance. Man, fill out the intake packet. I'm sorry. Let me stop. You have to fill out the intake packet. So I'm gonna tell you mine's. You could also go to my website, www.kingdomcreativecounseling.com, and look at kind of general what it looks like for my therapists who want to start private practice. You can look at my example. Now, don't print these out and use them, okay, and copy them, because you got to look at your state and what your state regulates. So mine is a demographic form. That's one form. Another one is a consumer consent for treatment. It tells you certain things about treatment. Like, once you get an evaluation, it doesn't mean I'm your therapist. We will determine at the end of the evaluation what the next step is. It could be we follow up with another session. It could be you need a higher level of care. It could be I need to refer you to a psychiatrist. Okay, and it has things like I don't fill out FMLA paperwork. I don't do that. So it has you kind of like what is expected of you, and then what is expected of your therapist. Okay, so that's your consumer consent for treatment. I think that's it. Those are the main two. Also, another one that I've introduced is because of doing more telehealth. It's called a telehealth behavioral consent. That's more like a technology's consent form. It just means that you know that we're using HIPAA compliant resources in order to offer you that service. And I think that's it. Now, any other those are the main three. There are some other ones, like let's say for example I get a referral from someone who is being referred from DSS. Well, we need a consent to communicate with DSS to say that you've come, or maybe referred by the courts. And of course, need to follow up. I don't have a lot of clients, but I do have clients who get referred from different places, and we need to communicate. And so we get a consent because again, everything is confidential in order just to be able to communicate that, hey, such and such has come. We need a consent form. Now again, I always tell my clients, if you refer from DSS or the courts or whoever, I'm not telling them the depth of what we talked about in our sessions. I'm only confirming that you've come. I'm not telling them of the time you abused when you were 3 and 4 and 5 years old, things like that. That's personal information that I'm not going to give them access to, but I'm really going to confirm that you've been coming. Okay. So you have to fill out your intake packet. Okay. Now you may have, depending upon your insurance, you may have a deductible, you may have a copay. In my organization, you have to fill out your intake packet 24 hours before your appointment. If it is not filled out 24 hours before your appointment is automatically canceled. Now, we send it to you as a virtual packet, okay? It's an encrypted virtual packet. So you do get it in your email, but no one else can read it. But the reason why that is because this is one of the downsides of being a therapist is because we got to verify your insurance. And that's not a quick process. Sometimes it's easier. We just go on our provider portal, look it up. Oh, you have a $25 copay, or you got this kind of deductible, and we tell you that in advance. But sometimes then with the insurance companies, lots of times we got to call somebody and be on hold for 11 hours. And if you fill it out at the last minute, you may be stuck with a bill that you didn't anticipate because you didn't fill out your intake packet in time. And we risk not getting paid, but you risk having a bill that you don't want because we try to verify all that information before your actual session, okay? Then after you fill out your intake packet, okay, ours is now virtual, but we do have the regular paper ones. It's literally sent to your phone, and you can look it up. You can sign it over your phone, over the email, over your internet, whatever you want to do, and it is HIPAA compliant, okay? But again, you see us in office. When we start going back doing in office, you can do it either way, paper or whatever. Then the first session is your we call it evaluation. And that just means that we got to figure out what's going on. We ask more questions. And it doesn't necessarily become full-on counseling. I try to give you some nuggets in there, but we have to do an evaluation, okay? And the evaluation, we ask you domains. And one thing I tell my clinicians is that because someone has symptoms does not necessarily mean that we're only dealing with the symptoms. How did they come to those symptoms? What's going on? We call this, what's going on with your family, your friends, your medical health. All those things may impact your emotional or your mental health, okay? It's not always cut and dry. So you have an evaluation, and then we figure out what do you want to work on, okay? And that's usually at your first session, okay? And I think that's it. And then we just continue to go on. Now, other things to consider is that, and people say therapy doesn't work. It does work, but there's different things that make it not work. One, you do have to. It's not like going to your medical doctor and they say, "Hey, take this prescription and call me in 2 weeks." It doesn't work that way. There are things that you have to do to be an active participant in your own healing. Okay, so now people come in like, fix me, Samaria, fix me. And I'm just like, first off. Other thing is that, and this is true, y'all, sometimes you get a therapist, you still have to remember, even though they're highly trained individual, sometimes it's not a good fit. That therapist personality type and your personality type may not mesh. Okay, and that happens. It happens to me. Not all the time. Most people like me, but sometimes it may not work because your personalities don't mesh, and you don't feel good about it. I had a client who said, "What is it?" He said, "I went to a therapist. She was talking more about herself than me. I left." That's not an appropriate thing for a therapist to do. Okay. I remember, this is a true story, y'all. I'm almost done. I'm rambling now, but I'm done. Okay, I remember I was working for an agency, y'all, and I had just been hired as a therapist, but I was what we call an intake therapist. Simply means this: I wasn't really doing therapy. I was only doing what we call intake assessments. Okay, I will be referring to them to the treatment therapist. Okay, and I went to this agency. The agency had been in existence for years, but people come to the door and say, "Hey, can I work with you?" But they're like, "Listen. That therapist, her name was, I'm not going to tell you her name. Her name was beep, beep, beep. Please don't refer her to me. Please don't, I don't want to meet with her." Like literally back to back to back to back. I mean, it got bad. I was feeling kind of, some kind of way, because after I did my intake, I would have to assign them to a different therapist because I wasn't seeing clients. They're like, "Can I see you?" I'm like, well, technically, I'm only the intake person, which, but I mean, this therapist, literally, y'all, I mean, people will come to the door. "Listen, I don't want to see her. I don't want to see her. I mean, different. I don't want to see her." But there's another therapist who was amazing. He got a lot of slack at that company, by the way. People come to the door asking to meet. "Can I meet with such and such?" He was really good. "Can I meet with such and such?" He was really good. He was an amazing therapist. The other therapist who people are complaining about, like, she was complaining to the supervisors about me because I wasn't referring anybody to it, which is true, but I didn't want to get involved in that kind of mess. You know what I mean? I didn't want to tell people, "Listen, people are coming to the door saying, like, don't work, like, they don't want to work with her." And it was like bad I mean, she was really bad. The point I make with all that is that, this is what I'm saying, is that sometimes you'll meet with somebody and it's not a good fit. Every therapist who becomes a therapist does not necessarily should be doing therapy. Sometimes therapists have not truly dealt with their own stuff, and that's why they became to be a therapist. You're not always going to be a good fit, okay? And sometimes people are looking for these really great knockout sessions, and it doesn't always happen that way. You have to keep going back. You know what I mean? You're not going to have these great... Sometimes we have sessions where it's this great aha, "Oh my God, oh, thank you." Sometimes we just set a foundation for that, okay? So it is a process. I tell my clients all the time, it is a process. It is not an overnight thing. If you look for overnight deliverance service, sister, you may need to go to your church. This ain't it. It's a process, okay? And something that happens quick, it happens quick, but you don't always are fully healed because you never dealt with the process or the mentality behind that. So what therapy is healing, okay? Other things to consider, again, coaching is not counseling, okay? Coaching is not counseling, okay? And again, because people are fascinated with therapy, we got coaches who say, "I want to do therapy, but I don't really want to go through the process of becoming a therapist, so I'm going to do coaching instead." Coaching is not therapy. Therapy is therapy. Coaching is coaching. Coaches do excellent jobs. Therapists do excellent jobs. But we all need to stay in our lane. Okay. Now, let me just clarify. There are therapists who do counseling and coaching. Okay. And again, they do counseling and coaching. Okay. So they may have coaching clients, they have counseling. That, I know it could be a little bit confusing, but they will tell you that I am licensed in the state, or I have a master's degree in blah, blah, blah. And I also offer like business development coaching or something like that. Not for the same clients, but for a different set of clients. Okay. Trauma coaching is not a thing. If someone says, "I'm a trauma advocate," or "I'm a trauma-informed person," and they're offering you trauma-informed coaching sessions, as I said before, this is somebody who wants to be a therapist really, 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 really bad, but they refuse to submit to the process of becoming a therapist, so they want to offer you sessions. That is not appropriate. Coaching is simply motivational services, helping you to build your business, your brand, help you to get unstuck, help you to be motivated, but it's not go back to deal with mental health or emotional wounds, okay? Mental health advocacy is not counseling. I've heard people say, "I'm a mental health advocate. I offer counseling sessions." Mental health advocate, you can do so many different things in the mental health field. You can be a peer support specialist. You can do case management. You can work as an advocate. It is not me that you are qualified to offer counseling services or therapy services, okay? Now, other things to consider is professional boundaries, people that I cannot see. If you are watching me on this, on my personal timeline, more than likely, I cannot see you. We do have therapists, we have professional boundaries. And so it will be considered a conflict of interest if I see someone that I know personally for therapy. Now, my friends or something like that just call me for basic, hey girl, let me get your ideas. That's one, these are my friends. But when it's like you now have a issue and if you need some counseling for, then I will give you a referral for a counselor or therapist. I can't offer, you know what I'm saying? So it is a professional boundary, okay? Other things that we can't barter for services. Again, professional boundary. Let's say, for example, I had a client and he has a daughter. This is hypothetical. It's not real. And the client just happens to be a mechanic. Let's say hypothetical. My car is fine. Let's say hypothetically, my client says, hey, I can't afford counseling, but my daughter here, she needs counseling. I'm a good mechanic. I see your car outside. If I fix your car, will you give my daughter some free sessions? If we can't do that, you know what I'm saying? That's a professional boundary. It's a boundary. It's an ethical code that we cannot cross. Okay. Also, I do not date my clients. Few people ask me, what do you mean a client? He's a man and he's very attractive. He's just attractive. No. Therapists do not date their clients. So we all see that on little like television shows and stuff like that. That's not true. I am way over my time. So we do have professional boundaries. And professional boundaries help us to have stamina. It helps us to adhere to our code of ethics. It helps us not to have burnout. It helps to protect you and it helps to protect us. Okay, I'm good about, well, my profession does not tell me, I cannot do this because I'm not trained or credentialed to do that kind of thing. I just throw it on my training, okay? Why people don't see a therapist. Now, again, we talk about stigma. We still see a lot of church stigma. People who need counseling oftentimes don't go. So stigma. And we got to break the stigma. Remember, y'all, when you go to see a therapist, they are obligated by the law to confidentiality. Obligated. A therapist is not going to lose their license because they're trying to tell your business. Okay. Some people think, oh, it didn't work. Well, again, I just told you again. Sometimes it just don't mesh with the therapist you're seeing. Sometimes it does. Sometimes you got to keep trying. You got to keep coming back. Don't look for an immediate response. Okay. Also, some of the people don't think about is pride. It takes a lot of humility but strength to go sit down and talk to a complete stranger about your inner hurts. I probably this week have said, I really appreciate that you called. I was like, I know it was difficult for you, because the person never been to counseling before. I was like, thank you so much for calling and showing up. I was like, I know it was probably difficult because from what I'm hearing you tell me, you've never gone to counseling before. Like, that takes a lot of strength to go to your therapy and then open up at your first session about stuff that you may have never told anybody. And that tends to be how it happens. I never force anyone to talk. I have to ask certain questions. And if they don't want to respond, I'm not a pusher. I'm not going to push you to talk about stuff. But I've had clients they just want to open up. Like, the time I was abused when I was 7 years old, I never told anybody. My mom didn't believe me. And I never went to counseling. And you know what I'm saying? And to hear someone validate that, is amazing. But some people don't want to go to counseling because of pride. They do not, particularly leaders, particularly my ministry leaders. I know people, child. I just know people who call themselves, I can call it a title, elder, pastor, apostle, what do they call it? Superintendent, whatever you want to call yourself, a Bible teacher, prophetess, prophet. And my name ain't Mary Cole, but these people need to go to therapy. And I'm not saying call me. I'm not saying call me. But show as my name is Samari, this person need to go see the counselor. Okay? And not recognizing the benefit of it. Some people don't recognize the benefit of it. This is why we have a lot of people who they don't go to counseling right away. They wait till it's like crisis mode I'm sick and tired of being sick and tired. I'm sick and tired of being on this roller coaster. Now I'm going to go to therapy. Okay, we're almost done. Now I'll tell you, my time. I went to therapy. I'm gonna tell you about this because I understand what it's like to be in practice, successful, doing your thing, and then you gotta wake up one morning and say, I gotta go see a therapist. And this happened recently. So I had my business. I'm already licensed therapist, been in the field, writing books, whatever. I'm healed, hallelujah. So I had pain just show up at my door. Just pain. And no matter what I did, it wouldn't go away. Pain, 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 pain. And I was like, I don't go see a therapist. I'm already a therapist. I'm a therapist who sees therapists. I'm always telling you to go to therapy. But then I had to say, Samaria, I've always told myself that I'm healed from the stuff that happened to me when I was younger and the abuse and things I've experienced. I'm healed from that. I've done the work. But pain just showed up at my door one day, and I think, I gotta go to therapy. I didn't want to do it. Because one, I had to humble myself, admit that I'm in pain, and go to therapy. But the pain would not go away. And I feel like I almost went backwards. You understand? And I felt almost like ashamed. Like, here I am, a therapist. I got degrees, sis. Like, I got a whole business. I gotta go to therapy. No. Again, I'm telling you myself. I'm not telling you to do that. I'm just telling you my thinking here. But the pain wouldn't go away. And I got so desperate. And I shouldn't say desperate, but it's true. I went to therapy. And I told my therapist, and she laughed at me. I told her, I said, listen, I'm a therapist. I'm my own private practice. I just told her right on out. And I said, it took a lot for me to be here. And she laughed. But she wasn't laughing like, girl. But the fact that she wasn't laughing like at me, but she was like, okay, well, come on, let's talk. It was the most phenomenal experiences. I don't currently see her right now. I have no problem going back to see her. I just haven't seen her probably in a couple months. But sometimes you think you're healed, and then something else comes up and you realize I'm not healed in that area. And so I told the story last time, but I'll tell it again. I'm going to tell you exactly what we talked about. We started talking about some things and why this pain. And she said, well, tell me why this area causes you so much pain. And I said, I don't know. I paused for a minute. I paused and I was like, I don't know. She said, we'll talk about this in a bit. Let's go back. And she started, let's go back. And she gave me the therapeutic homework works. And in between that and our next session, I think our next session was next week, I did the work. I started looking at why this area of my life was causing me so much pain. And I was able to successfully set boundaries in other areas. But in this area was triggering pain in me. And to the point where I was like really just not doing well. We started going through the process, and I realized there's certain things about me that I was doing to seek validation, to seek love, to seek affirming, to seek what I already had. I thought that if I could fix this, if I could do this, if I could fix that, if I can accomplish that, then I'd be okay. Then you would love me. Then you would accept me. I didn't realize that. So doing this process of kind of going backwards, and she did, again, licensed therapist. She did some inner healing work. Okay, she probably didn't call it inner healing because it's so inner healing in mental health therapy is called two different things. It's the same thing, but we call it in the Christian world we call it inner healing. In the secular world we call it something else. Okay, but we went back. And then from going back, from uprooting what the behavior was and understanding the process, we were able to input some new strategies to let go of the things in the past that I had been doing that were related to this false identity. Okay, this false identity, the identity of I'm the fixer, I gotta fix it, or you gotta like me, about that thing that I thought was not me. And so it was a great, amazing experiences, a healing experience that contributed to my healing. I still have my therapy. I don't have my therapy appointment, but I still have my therapist's contact number. And the reason why I said it is because I do understand like what happens when you're in ministry or you have a title or you've accomplished certain things, and you just think if you're past, and then you wake up one morning and think I gotta go to therapy again. You know what I mean? And I'm a therapist, so you know what I'm saying. I was like. Right. And I was telling my therapist, no, I'm done here. I was telling, you know what? I said, I understand these concepts and I talk to my clients about them all the time. I never thought that would be me. Like I just, you know what I'm saying? Because you don't always connect the dots, even with your best efforts. And a therapist pulls it out. Again, a man of understanding pulls it out. Okay. So hopefully you guys can seek therapy. Again, www.samariacoper.com is my personal, my website. That's my website. My business is www.kingdomcreativecounseling.com. If you want to know more about that training as well, you go to that website. Either website's going to get you there, but www.kingdomcreativecounseling.com is going to be a tab that says trainings. You look up for that. And again, it tells you just a little bit more about me. And I think that's it. All right, y'all. This is Dr. Samaria M. Covert. And it's been fun. This will be available on my YouTube channel. And make sure you like, make sure you comment, and then make sure you subscribe. Okay? Bye. And go to therapy. Go to therapy.